Hello, guys. Welcome to today's live. I welcome you all to the live section. You're welcome. So let's talk recovery. Let's talk about recovery after childbirth. So we're expecting the life to be flooded with a lot of mothers because the questions I do receive, that's questions that I cannot just tell you, oh, yes or no answers. Yes, we deserve more than yes or no answers. It's not like there's some questions I see when I look at them, I just feel very, you know, should I use the word pity? I don't know whether using the word pity would be the right translation, the right meaning. But I feel down. Like, how am I going to help this woman? Does she not know that this kind of discussion, it's not all about yes or no answer? Or, for instance, like the video I made today, the woman said that she saw her meses, that she saw her lochia. She bled for 2 weeks or 3 weeks or thereabouts. And after that, 6 weeks later, she started bleeding. Is it normal? So this kind of question is not something I can just tell you, oh, it is normal. Do you understand? It's not something I cannot say, okay, oh, it is not normal. I hope you guys are understanding. If I tell you it is normal, when I don't even know much about you, I'm not helping you. I hope everybody is not the same. And that is why recovery after a delivery should be as minimal as individualistic. You treat the woman, you guide a woman based on who she is. Because everybody is not the same. We cannot use one hand to handle everyone. You know they work like that. You're getting it. So if you ask set a question like that, okay, you are menstruating, and at a point, I say menstruating, you are seeing your lochia, and it got to a point, the thing appears as if it has ended. Few weeks after, he started seeing blood. Doctor, is it normal? Is it normal? I can't tell you yes or no, honestly speaking. Yes or no is not enough for the answer. You deserve explanation. You deserve to know what is happening in your body. You deserve to understand your symptoms. You deserve to know what else could be happening. Of course, it could be normal. But what if it is not normal? Let's assume everyone tells you, oh, it is normal. And at the end of the day, there are things we cannot really see because we've not had much interaction with you. So it's good for you to ask questions in the comment section, but I think we should understand that just getting an answer, just getting a one line answer may not really help. You need to understand what is happening. You need to be told. Do you get it? You need to understand this because when you understand it, it takes care of every other questions. It takes care of every other thing. When you see other abnormality that is in that regard, you will know, oh, doctor had told me this, and I think this is why this is happening. But by the time you take yes or no answer, you will keep asking questions because you are not yet you are not yet grounded in what is happening. So every mother recovering from childbirth deserves to know what is happening in her own body. You deserve to know what is happening in your own body. You deserve to understand it from the beginning, right from when you are yet post-op. You deserve it. It's good we go to antenatal. It's very good because at that time they'll monitor you, they monitor your baby. Everybody cherishes the baby. Everybody's after the baby. You go for ultrasound scan to check the state of the baby. You do other things for the baby. Now the baby is out. What is the next thing? Should you not abandon your life because the baby is out? I know how much people invest in pregnancy. Sorry to say this, but I just want to be real with you. How much you must go for your antenatal class, isn't it? to know how the baby is doing. Check my baby, check me, check my, how am I doing? How is baby? Is the baby kicking well? Can you hear the baby sound? Can you hear the baby heart? Can you hear this? Now the baby is out. Don't you think it's also very important to know what is happening in your own life? Yes. Don't assume, oh, it will go with time. Some people don't always find it easy. Yes. Some people suffer from what would have been addressed in the immediate post delivery. What would have been addressed? Some people suffer it years beyond 5 years, 6 years, 10 years. So every woman deserves to know what is happening in her body after her baby is out. That is why I'm opening this live for you. Hi, who is this? Mame Konadu. Hope I got your name correctly. You're welcome. So I was expecting a lot of questions, but since there are none for now, I'm going to take some I've had before, possibly to help one or two persons out there for you to understand what we are doing. I hope this question helps one or two persons out there. Where's that my question? I saw this question. I'm coming. Who is there? You don't have any question to ask on behalf of your family members? Good. This is that Christian Postpartum. So a lot of persons have questions. I don't know whether it is shyness or boldness. Honestly, it's not easy. Sometimes you may have questions, you may want to ask about yourself, but the boldness, healing comes with boldness. It comes with confidence. And knowing also gives confidence. So that's why I want every mother to know. To know. It will raise your confidence. Is it confidence now or confidence? I don't even know English. So it will raise your confidence and then make you to defend your body anywhere. Anyone I say, I'll just answer. So maybe I'm sorry. I'm coming. I'm looking for a question. I can. Postpartum now. Where is this thing? Okay. Okay, I think I've answered this question. I've done a video on this question. When can we back our baby after cesarean section? I did a video already on this. When you can back your baby after cesarean section, we'll start with when you are able to twist that baby behind you. Let's start from that one. You're able to twist the baby behind you. That should be the first sign that your body should give you that, oh, I'm able to twist this baby behind me. No, it's not somebody putting it behind you now. When you are able to twist the baby behind you, 1. 2, when your wound has fully healed outside, backing up baby, you will need wrapper to hold the baby, and keep the baby in place. So, and some places, after using the wrapper, you will use another one that looks like scarf to tie the baby. So when you are able to twist the baby, and when your outside wound has fully healed, so that your tying of wrapper and the other things that will keep the baby in place will not disturb your wound. Omaima, hello. Thank you for joining. I'm trying to sort questions since nobody wants to. This is a very common question. Is it possible to be pregnant when measles is not back? Is it possible to be pregnant when you have not resumed your menstruation? Now, before I will answer this question, let's finish up with the first, the one I raised. When are you supposed to back your baby? So your wound should have healed. There should not be any dressing, like any dressing that would disturb your tying of wrapper and your wrapper would disturb from healing. So allow your wound to fully heal. You can wait till 6 weeks when you are when your wound has fully closed and when you are able to twist the baby behind you. This will guide you. And whenever you are doing any of these things, even if it is written in any book or it's coming from my mouth, the most important sign you should always look out for is how your body responds to all the plans, all the advice given to you. That an advice is given to you doesn't mean that you must take it or it's okay. When should I resume work? You know, such things like that. When should I resume work? When should I resume work? It will depend on how strong you are. They may give you 2 weeks maternity leave, 6 weeks maternity leave, and it is written that, oh, resume work when you are 6 weeks. But what if at 6 weeks you are not strong enough? You see, your body is your first sign, your first reminder that, okay, you can do what you want to do. Now, let's look at this. Getting pregnant when your menses have not resumed. You had your baby, you had cesarean section or natural birth, and you are breastfeeding or whatever the outcome may be. Okay, but now you have not yet started seeing your menses. You know, when a woman delivers, it takes like months before menses resume. For some, it may just take week, but that is another discussion. Let us finish this getting pregnant when your menses is not yet back. So you can get pregnant when your menses is not back because your ovary, where the eggs are released from, can be active. Your ovary, your ova can be released. Your egg can be released even before you start seeing your menses. Your eggs can be released even before your first menses. So, of course, you can start seeing your menses. You can even get pregnant before your first menstruation. So, there are some mothers who will not even see their menses. They will just, after delivering, the next baby will just come with no sign of menses. And it is very, very normal. It's very normal. So if you are blessed, your ovaries are blessed, your eggs can be released at any time, and you want to space out your children, you want to have family, you want to space out your birthing time, I will advise that immediately you give birth, you should start discussing, you should start making plan for your family plan, the kind of family planning you need to use so that it will not take you unawares. So baby can be formed even before you start seeing your menses. I'm still waiting for your questions, but that will not stop me. So yes, baby can be formed before your menses. Your menses is not what determines whether you are going to get pregnant or not. Menses is just your womb, shedding out its old self, although which can be regulated by the hormones that controls the release of the egg. Okay, but that you are menstruating or you are not menstruating will not stop the egg from leaving the ovary. You understand? I hope you are getting it. And this one is ectopic pregnancy. I don't want to talk about ectopic pregnancy. Okay, this one. I've also made a video about this one saying, Doctor, please, When is it advisable to have intimacy after cesarean section? I am a first-time cesarean section mom. When is it advisable to have intimate relationship with your husband, with your partner after cesarean section? That's a very important question. So some may say, why are you concerned about intimacy? You just finished downloading when you're talking about intimacy. I better rest. What works for one family may not work for another family. And how the family operates may not be the other one. They understand themselves. If they feel that that is the only thing they want to be doing, I don't think we have any say over how they want to run their relationship. So this question is very important for some. Very, very important. Now, when you have your cesarean section, you were caught. Okay, your skin was cut and other layers of your body was cut, your uterus was cut, and these places were also sutured, they were stitched together, and it needs time for the suturing to glue together so that healing can occur properly. So it is advisable for you to wait till like 6 weeks, because this will give the wound to heal. It will give the wound the time to heal. Secondly, it also gives the uterus, the womb, time to heal. Where the placenta left the uterus, the baby grew with the placenta. Where the placenta left in the uterus also needs time to heal. And if it is not healed, infection can be introduced into the womb. Is that clear? So that is why you are advised to wait at least for 6 weeks to allow the wound, both the wound that was created to bring out the baby and the wound that the placenta, the place that they remove the placenta, they call it placenta bed, so that the placenta bed can heal adequately. Your uterus sheds all the blood in there to avoid infection. That is why you are advised to wait. Not like waiting we confer any other benefits per se. Okay? I've even heard that some people do it 2 weeks after. Some people say they do their own 3 weeks after. That is, I don't know. I feel it's quite risky. But the ideal thing is that you should recover fully so that you will not worsen your recovery journey. Okay? Your hobby, your partner can wait. If there's other way to have a more intimate relationship, fine. Okay? You can hug, you can do other form of intimacy to keep the atmosphere burning. All right, so that is it. I don't know if any other person has a similar question or something to ask. I'm still waiting for your questions. But why is it that on the platforms, I see a lot of people asking questions? Now, come and ask your question. Come and ask your question. Yeah, nothing spoils, Sha. Let's continue. And I'm glad some persons are here. Okay, this one's asking how long should she wait after she has an S-lap. She had an abdominal surgery. That's S-lap for whatever reason. I don't know why she had it. So she had a surgery, and she's asking how long can she wait before she gets pregnant again after an abdominal surgery. Well, it depends on the type of abdominal surgery you had and why was it, what was the indication, why was it done? Is it something that just, is it exploratory? Is it just normal diagnostic? Was it as a treatment? Was anything caught? The thing that was caught, if yes, How long will it take to heal? So in such case, you need to discuss with your surgeon that did the exploratory laparotomy. You need to discuss with the surgeon that had the abdominal surgery, and to know how long it will take for you to fully heal before you can do any other thing. So that will not determine when you'll be advised to get pregnant again. Now, this is a very common question. How will I make my tummy flat? What can I do to make my belly become flat? I'll also do this. I'll do a video on this, but let me say something. You see, when it comes to flat tummy, I appreciate that everyone is differently. But when it comes to flat tummy, we should understand one thing. Flat tummy will depend on what happened during your recovery, during your delivery, during your pregnancy, and before your pregnancy. So you need to did anything go wrong during your recovery? That can affect how your tummy. Did anything happen during your delivery? Did anything happen while you were pregnant? How was your pre-pregnancy tummy? You know, we are so quick to ask how to flatten the tummy that we do not really ask what really made the tummy to be big in the first place. Yes, we need to know, okay, what really made this tummy? We need to understand, excuse me, we need to understand what really made this tummy to be this big. Did the tummy decide to be big to frustrate us, or something happened that led to it? Now, when you're able to understand if something led to the big tummy, then you know how to approach it. Now, generally, when a woman delivers, the tummy will be big because a human being came out of it. The tummy was stretched by the baby. No matter how small the baby is, the tummy will be stretched. So it's not common to see a day or 2 day, 3 day old mother with big tummy because the baby just left there. Now, going forward, how was your recovery? You need to start learning how to use that tummy to breathe. Do you understand? As you are healing, you need to tell the tummy, your brain needs to send a message to the tummy that there's no more baby here. You need to put yourself together. Now you need to start learning how to breathe. Start using the tummy to breathe. Some call it deep breathing. Some call it diaphragmatic breathing. So you need to start telling the tummy. You need to start retraining the tummy that, see, you are to put yourself together. And this breathing, this post-op breathing also helps the body beyond this tummy talk we are talking about. It sends message to the nervous system, the system of our body that controls emotion, that controls touch, that controls pressure, that controls things like that. It sends message that let's help this body to come together. So it helps your core, because this particular place we are talking about may be your tummy, but it plays a major role in your whole body system. So first, you need to start learning how to breathe very well. Secondly, you need to know how to be patient. You carried the pregnancy for 9 months. The tummy got expanded. You should be patient enough to allow the body to take care of itself. Don't rush the body into recovery. Give the body what it needs. And what it needs is to wake it up by your conscious breathing, being patient with it. Do not rush it. The next thing, nourish it. Some persons had normal separation. Some persons, the separation may have been done by their surgeon. Some persons, their lower muscles may have been cut by their surgeon. So you need to heal these things. If it is just ordinary separation, you need gentleness to heal it. If it is the one that was cut, anywhere that is cut through needs healing process. And the healing requires good nutrition. You need to eat well, not just eat, but eat well. In the fourth trimester blueprints I made for you guys, everything you need to know about how to eat, when to eat, and what to eat have been well written down there in details that you may not even need to you don't need any other information. Everything you need to know about what to eat in your postpartum recovery is there. So you need to eat well, not just to eat amala, not just to swallow, not just to eat, but eat your proteins. Make sure you are eating your proteins. Our pepper soup, although it doesn't need to be spicy, they have anti-inflammatory properties. They also have healing properties. So you need to eat and eat well, okay? Now, by the time, if your hospital, your midwife, your doctor permits, but this is my own recommendation, that having cesarean section shouldn't be against you wearing an abdominal support. You need to wear an abdominal support. I'm not saying you need to wear your girdle. I didn't say you need to wear your waist trainer. I said abdominal support. I didn't say something to flatten your tummy. I said abdominal support. In some hospitals, your doctor, your surgeon may recommend it from the very beginning, from the day you are discharged from the hospital. Sometimes, some places, you may need to come back in 6 weeks' time at your assessment, can tell you, okay, go and put it on. But that is not to say that you go and start wearing it because you heard it from Dr. ECO. You now go and wear it. At the end of the day, you put yourself, okay? So your doctor needs to know that you deserve it. And one other thing I need all to understand is that something is recommended for Mrs. A doesn't mean it must be recommended for you. You had an issue. A particular plan was made for you. It doesn't mean that that particular plan must work for this person. Because we are all different. We are all different. So you may be two. The doctor will see one and say, okay, you start wearing. The other one, when you come back in 4 weeks' time, or you come back in 6 weeks' time, I will look at you and know whether you should start wearing or not. So abdominal binder, abdominal wrap is very essential in helping your core to be put together. That by the time you have been cleared by your doctor, that you are fit, you can now start rehabilitating the core. Start doing core exercise. Start waking the core alongside the breathing exercises you have been doing. So you start breathing, you start doing your core exercises. I also need to let you know that there are a lot of experts in this. Okay? There are a lot of experts. You can, get their services, they will guide you so that you will not get it wrongly. Many mothers have heard, oh, start doing your abdominal exercise. You will need it in 2 weeks, you'll be okay. Let me tell you a story. After my first cesarean section, my tummy was still big because I didn't even know all this information. Who has time to be sitting you down to teach you all this after recovery? Who has the time when they need to attend to patients? Who does? I want to be setting in our Africa environment or wherever you're watching from. Who has the time to sit you down and be telling you, madam, when you finish, you do like this. When you finish, you do like this. Once they discharge you from your hospital, your child now, the next thing is, if it's a male child, you will plan for circumcision if you believe in it. You will plan for circumcision. If it's immunization, no, you people will go for immunization. Immunization, okay, madam, have you immunized your child? 6 weeks time, come for your immunization. Who asks you how you are dealing? Most of the things you hear, most of the healing thing you hear it from the internet, you hear it from the social media, you hear it from friends, you hear it from, nobody sits you down. There is no system. There is no hospital system that's okay. Every mother that are delivered will see you people in 4 weeks time. We'll see you in 2 months time. That is why I'm emphasizing that recovery is beyond 6 weeks. Now back to the story I was telling you. My tummy was still big. This was like 2 months after my cesarean, 6 weeks or 8 weeks or thereabout after my cesarean section. So I met a family friend, a medical doctor, and when she saw me, when I say medical doctor, I don't mean, it's not my age, it's not my size, big medical doctor. So you can start doing your tummy exercise. You do your crunches now. You do crunches. You do this one, sit up. Start doing sit up. You must have heard it. Start doing sit up. Your tummy is still big. Start doing sit up. My dear sisters, sit up is not for everybody. Sit up can worsen your issue and worsen that big tummy you are trying to flatten. Sit up can create problem for you, more problem for you. So that is why I said there are professionals that will guide you in this. So sit up is not what you should. Okay, you have heard abdominal exercise. They say, doctor said once I'm clear, I can start doing my tummy exercise. You need to know the kind of tummy exercises. Fortunately, I made a video about them. I even demonstrated it in this channel that I'm speaking from. I made a video, I demonstrated it, but you will not watch. But that is it. So, not every exercise that is good for you. No. If you do the wrong exercise, you can worsen the gap. If you have gap before, what they call diastasis recti, you can worsen it. You can worsen hernia. Some women have hernia without even knowing. Some have diastasis recti without knowing. All they are concerned about is how to have a flat tummy. So that is why I said you need to know what has gone wrong in you to be able to know how to tackle it. Now, by the time you start rehabilitating your core, start doing your core workouts, You have the heel slide. You check. Even on YouTube, I know there are a lot of maternal recovery exercises by experts. You see them on YouTube. You watch. If if it requires you to seek their services, you seek their services. It's not, nothing is too much. Nothing is too expensive for your own health. So if it requires you booking, getting them as coach to coach you, well and good, because it's for your own good. Okay? Now, you start doing your core rehabilitation exercises, your heel slide, and the rest of them. And give your tummy the time to heal. Even if at 6 months it's still big, keep working on it. Keep healing. Don't be discouraged because your tummy is still big, 6 months after. Because someone out there, her tummy is flat at 2 months, 3 months. Remember, people heal differently. Secondly, some people are genetically blessed. You see me like I am not blessed with flat tummy. My family is not blessed with flat tummy. That is not an excuse, by the way, but I'm telling you the reality. Some of us will want to push away the reality and console ourselves. Some of us, our tummy can never be flat. Yes, it can never be flat. But the most important thing is that you are able to control your core. You are able to control your breathing. Have you not seen people after delivery? They're just breathing up. Not like they have chest problem. They don't have heart problem. It's just that they have not been able to heal from within. The core is still flat, it's still weak. So you need to start working on your core. Flat tummy is not a certificate for recovery. Okay? Having a flat tummy is not a certificate for recovery. If you have flat tummy, fine. If as you are growing, the flat tummy cannot be achieved, you can look at it and find out why your tummy is not getting flat. Why? Then when you found out and it is something you can approach, you keep healing. Healing takes time. Healing takes time. And those people you are seeing on the media, on our platform, they have dedicated their life to all this for that exercise. You see a fitness coach, for instance, who has been doing this workout for close to 5 years. The person will show you a picture of her last delivery of 5 years or 3 years and now show you her own picture of today. In your mind, you're thinking that she just had that flat tummy today. No, let's always understand that reality, there's different, let's come to reality. First, sometimes let us not be looking at things like they are magical or they are from another world. This person is from another world. The person has healed since 5 years and is still continuously doing it. The person keeps doing the same exercise for over 5 years. And the tummy the person has been able to train the tummy, has been able to train the core, has been able to refine her feeding. And you look at the person, you think you can achieve what the person has achieved in the last 5 years under 1 month. My dear mothers, it's possible, but when you are adopting such, it should be realistic so that you will not get frustrated. And don't go and strangulate yourself in the name of trying to tie your tummy to flatten it. Wearing abdominal support, wrap, binder, using wrapper, using all that one that looks like tire to tie your tummy will not give you a flat tummy. It will not. it will not give you a flat. If it does, nobody, they will not tell you to, you will hear things like, wear this tummy wrap, but make sure you are not eating before. Make sure you are controlling what you eat. Make sure by 7 p.m. you don't eat again. Make sure you are not eating this. If only that one works, nobody will advise you about nutrition. So it all depends on what you are putting in your body, and also who you are. If you are meant to have flat tummy, you don't even need to struggle. Some within 3 months, your tummy is already flat. And also, this is just for your own recovery tips. If you don't have a support system, healing becomes difficult. If you don't have a support system, healing becomes difficult. So as you are healing and you want to achieve a lot in your recovery period, please have somebody around to support you. So for you to have a flat tummy, number one, be patient. Number two, start learning how to do breathing exercises. Number three, start healing from within. Ensure that whatever food you are eating is aimed at healing you. Okay, eat your proteins. You've lost blood during the delivery. You've lost strength. You've lost iron. Your baby is sucking from you. So you need to start healing. You need to start feeding yourself well. Then you need to be patient. You need to remove comparison. You need to be patient with your own body. Understand your body and be patient with it. And you should also invest in abdominal wrap. It will help you to put your core together until you start using your core effortlessly, until your core is trained enough to do the work. You start invest in abdominal support wrap or whatever name it is, but it should be to support you and not to figure eight you. Okay, then once you are cleared from your doctor, then you start doing your core exercises. Start doing your core rehabilitation exercises. Then be patient. Okay, I have a question. Oh, yeah, go ahead and ask. You just type it. There's no voice note here. Just type your question. Hannah, you are welcome. Hannah Samuel. Go on with your question, Mama. We'll show that question. Okay. Before she comes, let's. Oh, okay. You're welcome. Please, type in your question. Unfortunately, there's no voice note here. I'm waiting. Oh, okay. We are waiting. Now, like this question I have here, a mother was asking, please, doctor, what can I do to get my tummy flat after cesarean section? I am 7 days. Let me see. Oh, I want to show you so that you see this question. And somebody is 7 days post-op. I wanted to show you the question so that 7 days post-op. The question is, how can she get her tummy flat? That is why I said that sometimes let us, Let us be realistic in this thing, you know. Let's be realistic. 7 days after a surgery, your question is how can it's not like the question is bad. Do you understand? It's not bad, but this question is coming from pressure, not just ignorance alone. It's pressure. 7 days, 7 days post op, and I'm scared my stomach won't go back to its original size and shape. 7 days. She didn't say 7 weeks. She did not say 7 months. She said 7 days. How can she get her tummy back after 7 days cesarean section? My sisters, you don't need to be a doctor to answer this question. You don't need to be, even in short, you don't even need to be a mother to know what the answer to this question should be. This is just straightforward. 7 days after cesarean section. You see, when I say that we invest so much knowledge in pregnancy than recovery, it looks as if I am no. We know so much about pregnancy, but when it comes to recovery, something that has to do with our own body, something that has to nobody cares, honestly. Nobody cares what happened. Even when you try to explain how your body is doing you, what is the evidence? You go explain, tire, no evidence. Even when I say, I don't just know how my body is doing. I don't just know how I'm feeling. I don't just know how it's doing me. Nobody will answer. Only few can understand what you are going through. Hmm? The baby will be the attention of everybody. From naming, from what the ceremony, from dating, from whatever. They'll just tell you, eat, drink, eat, eat, eat. Has she eaten? She don't breastfeed. You don't breastfeed the pikin. Eat, drink, eat. Well, that is not bad. But at least as a mother, we need to have some level of information regarding certain things. Now, 7 days after your cesarean section, honestly, you are still healing. In short, you just came out from the theater 7 days ago. You are still healing. Some, their wound has not gum together at that 7 days. Some, by that 7 days, they are still carrying their plaster. The womb is still hard. 7 days. It's still there. It has not even gone down a bit. It's still there. So 7 days is too early to start putting pressure on yourself. It's too early. So what you should be concerned now about this 7 days, no matter how strong you may look, is how to breastfeed your baby, how to ask for help, ensure that people are there to support you. You check your lochia, your blood, are you bleeding well? Hope you are not bleeding too much. Your wound, are you dressing it well? Are you having time to sleep? Are you having time to rest? Have you started moving up? Can you now move from your bed, maybe to the sitting room? What can you now do? That is what you should be looking at. Yes, with time, flat tummy will come. If you have it, you will not lose it. If you have flat tummy, you will not lose it after delivery, even after cesarean section, except there is a complication. So, Mama Hannah is asked, please, I had CS I had last 5 weeks. Please, I had CS I washed a lot of clothes, and this morning, okay. Mama Hannah is asking, she said she had cesarean section 5 weeks ago. So yesterday, I washed a lot of clothes. And this morning, I woke up with serious back pains. I could not stand up straight, but I tried my best to stand up. But I tried okay. I still feel little pains. Can this be from the CS or the scar? A very interesting question. First, so sorry for what you went through yesterday. It's not easy, especially when you don't have any help. You know, when you have help, this wouldn't be an issue. You won't be washing clothes and doing all that as early as this period. Let's be honest with ourselves. So, especially when you don't have any help, there are clothes to wash, baby nappy to change, food to make. If you have other children, you need to take care of them. It's not easy. Now, I don't know how you wash the clothes, whether you sat down or you bent down as usual. So if you bent at as early as 4, 5, 6 weeks, you may experience what you experienced is exactly what you experienced. You bent. Okay, let me give an illustration. This is your whole body now. This is where your wound is, and this is your tummy. So when you bend now, when I bend this thing, can you see that there's now squeezing at that point? So when you bend, that point where you were caught, okay, this is your where you were caught. This is where you were caught, and that is cesarean section. Okay, I understand what you mean by this cesarean section, or where you were, or the incision, or the scar. The cesarean section, you mean the womb, the cut on the uterus. Okay, now whichever one, they are almost on the same plane, especially if the incision on the uterus was done like this, not like this. So if everything was done like this, they are usually almost almost the same plane, the same area. So at 5 weeks, you may have noticed that your wound is okay. Everything has gummed together. You are no more dressing it. You are no more cleaning it. Everything is, close together. It doesn't end there. It doesn't mean that behind it, healing is not taking place. Healing is still taking place. And that doesn't mean that behind it, something is opened. It can be closed. The closing will occur as early as 2 weeks, 3 weeks, but it doesn't mean that everything has healed. Healing is in phases. Okay, so at 5 weeks, you have not healed. Even that skin you are looking at, the fact that it is glued, it looks clean and everything put together, it doesn't mean you healing. The final healing has completed. It's still taking place. Healing is still ongoing inside. The body is still assembling other things to heal particularly the one inside. Now, by the time you bend, let's assume you were bending to wash your clothes. By the time you bend, can you see my hand? Now you are bending. You bend there, this place will squeeze. Do you understand? It will squeeze. That squeezing will squeeze the healing part of your body. We squeeze all the materials that have been deposited for healing. We squeeze the ones that are already trying to heal. It will squeeze the nerve. It will squeeze many things. So your bending is going to squeeze a whole lot of things that are responsible for your healing and that are healing. So this is not only to bending to wash clothes, even bending to sweep, bending to fold baby's clothes. The best you can do when you don't have anybody around you is to get a seat and make sure you put the cloth at hand, as in, don't bend into the clothes. Do you understand? You can raise the cloth high up, put your clothes in the bowl, you are sitting down, let the cloth be at your hand level. Do you understand? You don't need to bend into the bucket or bend into the bowl. No. If you will sit comfortably, you can put your bowl, your bucket on top of a stool so that you can be at your hand level, not you bending over. Is that okay? So both your womb and the scar are responsible for the reason you had the pain. Okay? And the serious back pain also came from the fact that your back, your hip, everywhere is connected. Your hip in front, your back, they are all connected. Your tummy, they are all connected. When the tummy is weak, the load goes to the back. When your tummy area is weak, when your pelvic, and the thing that causes this weakness, the baby, the size, the growing fetus, leads to weakness of your abdomen, of the muscle, of the pelvic area, and the back becomes the receiving end. So the pressure you applied by your maneuvering, trying to bend, trying to walk up and down, is going to sense pain back to your lower back, and you are going to feel it. Okay? So they are all together. They are not disconnected. The incision, the tummy, the pelvis, the back, they are not disconnected. They are all in your body. They are all connected. They all receive the same information. If it is too much for the front to carry, the back will help out. I hope this explanation makes the whole thing simpler for you to understand. We don't have help. God will help us. Life is inconvenient. Oh, okay, all right. I hope you understand. So next time you are washing clothes, because there are things that you have to do since there are no helps around. If it's very impossible to get help, maybe you are not staying around your friends, your relations, nobody around from left hand corner down up. You do it little by little. Okay, do it little by little before you wash, before you go and do something you think may stress you. Make sure you have rested. Make sure you have rested. Maybe lie down a bit, stretch your legs. Make sure you have rested before you go and do an hour, 2 hour walk. Because even standing for a very long time, we still put pressure on both the wound, the back, everywhere. So make sure you have rested. And when you are done with this kind of job, try and rest as well. Okay? Try and rest. So make sure when you are washing, sit down. If no chair, don't walk. Sit down, please. Okay. Sit down. Don't walk. And don't bend, I mean. Sit down. I repeat again, I wish other people are here to hear this. Put the bowl on a stool up to your tummy or chest area so that you no need to bend. Okay, please, I'm losing weight after my child's birth. Okay, it's also common. It's common to lose weight as opposed to the popular things you hear. I'm gaining weight. Now your own is you're losing weight. Now, after your cesarean section, a lot of things happened. I don't know whether this is your first time, you're a first time cesarean section mom. No, now a lot of things happen after cesarean section. There's what we call immune response to trauma, okay, inflammation. Those ones are just textbook talk, but let me talk to you in the way I know you will understand. After delivery, after surgery, your body needs a lot to recover. Your body needs a lot to recover. Aside nutrition, it needs a lot to recover. Not just for you to breastfeed, though. That one, breastfeeding is another thing. Healing is demanding after any surgery. Healing is demanding after any surgery. So, immediately your doctor says you are okay to eat. You see that food. I know you may not have appetite to eat. Appetite may not be there, but you just have to eat to help your healing. Okay? You need to eat to help your healing. So if you're not eating well, you may lose weight after surgery. 2, if you're a breastfeeding mother, you know your body is what is producing the milk for the baby. Is the milk is not coming from anywhere else. That production of milk requires energy, and the energy comes from food. So if you don't have that energy, if you don't have the food to make the energy, all the food that has been stored before, the body will break them down to bring energy for the milk to be produced. So you need to drink and eat, not just for the wound, not just for the recovery, but for the breast milk. 3, if you lost blood during your surgery, that one you may not know, but you may also know. That is why you need to discuss with your doctor when you are being discharged. What can I do? What happened? Is there anything I need to know? You may listen say, they gave you blood, though. You lost a lot of blood, though. Madam, take this so drug. You will need it because you lost a lot of blood. It may give you. So you may have lost blood that is giving you anemia. So in the presence of anemia, you may not be hungry. To that extent, you may not be hungry in anemia, in anemic condition. So how much are you eating? That is the question. How much are you eating? Now, let it not look as if I am insensitive to what you have earlier said. You said you don't have help. You are the one cooking. You are the one washing. You don't have time to rest as much as somebody who has all the village in her house. So this is already another stress now. It's already another form of stress. You are washing. Maybe after washing now, you cook, you will eat. Will you not eat? You will, even if you are buying the food, you will need to press phone to order the food. If you are not buying, you will need to go to the kitchen to cook it. So you are stressed. You are working. You are doing, instead of recovering, the energy you are supposed to be using for recovery, you are using it to work. You may not be sleeping well. So all these things can jump together and cause weight loss. And then you said you're a first-time mom. I don't really know what led to it. I don't know why you had the cesarean section. Sometimes the trauma that happened, the disappointments that follows may affect your emotion. That you are 5 weeks post-cesarean section doesn't mean that everything about you is healed. I don't know if you were planned for the cesarean section. I don't know if you dreamt in your life before you got pregnant that one day your first child will come via cesarean section. I don't know. But some people, that shock, that disappointment that comes with, also I wasn't able to experience these things. So after all my plans, so after all the struggles, so after these things, it ended up in cesarean section. Oh, I really missed out. I missed the experience. I really missed this. I needed to experience this. See, my dear, with all these things, for a woman who is having after third disappointment, the woman may not be willing to eat. The food may be there, but because the person is not healed mentally, psychologically, you may not eat. Not like you are deliberately you don't want to eat, but because you're not settled yet. You are not healed yet. And the worst is that people around you may not understand what exactly is going on with you. Now I say, it is my first time. You see, you said it's your first time, and you said it's depression. You see, if you tie everything I have been saying, you will see that there is a common factor to all of them. Okay? So, healing will come. Only you just have to be patient. Don't rush yourself. Don't just take it easy on yourself. Okay? Healing will definitely come. All right? I don't know. I know you had a good outcome. So just let me be grateful. Okay? Be grateful. A grateful heart brings forth happiness. Okay? All right. Oh, SHMO. Shmo. How do you shower with cesarean section? She's asking, how do you shower with cesarean section? I think this will be the last question. Then we'll call it a page. I've really tried. Now, how you shower with cesarean section? This is one of the common questions I see, and because of it, I sat down and detailedly wrote it in that maternal recovery guide. I will advise you get it, okay? Not just for the bathing aspect, but for other aspects of recovery, okay? Now, because I outlined it, everything is there when you have to bathe, what you need to avoid, what you need to look out for. Everything is well written down for the simplest understanding, as in everything is dead in that comprehensive maternal recovery guide. Okay, I'll leave the link to the guide in the comment section at the end of this live. So how do you shower after your cesarean section? You can start bathing as early as 2-3 days, even before discharge. Yes, even with your plaster, you can start bathing. Or you want to go and swim? No, I know. Yeah, you want to use the tub? No, you clean your body. You can start bathing, pour water on your body. But what we are very careful about is the wound. We don't want the wound to go and soak water. We don't want the wound to soak water. So you can cover the wound. If the wound is still in plaster, you can cover the wound with waterproof or waterproof dressing. Cover it up and then pour water on your body and clean your body. Now, by the time the plaster has been removed, then you can run water, clean water all over your body. And when you are done, just clean your wound. If it is still having some area that fresh areas, just clean with whatever thing you are asked to clean your wound. It could be methylated spirit, it could be ordinary water, whatever you were instructed to clean your wound. Just clean. Don't go and start bathing the wound, or you want to scrub it, you want to wash it, you want to clean it very, very clean and remove all the, no. Don't scrub your wound. You can bathe and clean off. Even if you are using overhead shower, let clean water run down you. But what you are not advised to do, swimming, soaking yourself inside water, it's not advised when your wound is not yet cleaned. It's not yet glued together. But for others, you can, once the dressing is removed, run a clean water over your body, and when you are done bathing, clean. So I don't know whether SMHO is still in the house, but that is it, mothers. All right. So I'll see you again, same time next week. So we'll continue talking about maternal recovery. So invite people. I'll also share the link in the WhatsApp channel so that you have access and put up notification for it. For this live record, I also share the link for those who missed it and would want to watch. In short, I would like that every mother, anyone recovering, should watch this video. Ask your question. Ask your question in the comment section of this video, and we will deal with all of that. Okay, my people. For the maternal recovery guide, I will leave the link to access the guide in the comment section of this live. I'll see you guys in the next one. Bye.